Welcome back to the Mountain Morning Show. With tax on everyone's mind right now, healthcare is a big issue, and so we have Beth Armstrong, who is the Executive Director of the People's Health Clinic here in Park City, here to talk with us about what's going on for their winter holidays, as well as Medicaid expansion here in Utah.
Hi.
Or lack thereof, I guess I should say.
Yes.
How are you doing, Beth?
I'm doing great.
Good. Happy holidays to you.
Happy holidays to you. It's such a festive time, and snow's coming, and everybody's so excited.
Everyone's so excited. So what's going on at People's Health Clinic right now during the holidays?
So we're coming down to the end of the year, which is fabulous, and it's been a good year for the clinic. I think it's been a good year for a lot of the nonprofits in Park City. We all work very closely together. None of us ever feel like we're in competition for dollars, because everybody in town has their specific projects that they like to give to. At the end of the year, we always send out an annual appeal. If anyone didn't get it one, I'd be happy to send one out to you. And it basically just recaps the year and tells the story of the clinic and who we've helped and how we've helped and what our plans are for the future. So this year we've seen more than 8,000 patient visits.
Wow.
And we do that on a budget of less than $900,000 a year.
Wow.
Which is a really tiny budget. We are able to keep it low because first of all, we're lucky enough to be in a building that we share with Summit County Health Department. We have a 40-year lease at a very, very low rate. So, and we paid it up front.
Wow, that's awesome. So you guys are there to provide health care for the community for the long term.
We're there for the long haul.
That's great to hear. I'm sure everyone's very happy to hear that.
And that was one of those gifts that came that helps keep our budget low. And then also our volunteers. We utilize 150 volunteers. About 40 of those are medical providers. And we're very fortunate in Park City that people come here to retire. So we get some of the best physicians, across the country that want to live in Park City for their retirement or come and have a second home. So whenever they're here, they come in and we have a dentist that comes. He comes only for the ski season, and he'll come in and give 1 day per week during the ski season.
Wow.
Which is taking time out of his basically vacation to spend time at the clinic and help the patients.
Wow, that's fantastic. I didn't realize you guys offered dental options as well, because that can be something that's, I know basic healthcare is already a barrier to some people, so going even the extra step to get their dental work done is huge as well. Right.
We have because of a very generous grant from Vail, Epic Promise, we do offer dental healthcare. So we have someone that's at the clinic every week, Marielle, who is the Park City Tooth Fairy.
Very nice.
So she comes in, volunteers her time, and does exams. And then if we see that any of those children that she sees needs additional care, then we send them to dental offices in town that have negotiated with us their rate, so that we can make those grant dollars go further. So those dentists agree to take the Medicaid rate for those dental services, and that just makes those dollars from Vail go
even further.
Yeah,
and that's fantastic. We need them to go as far as they possibly can.
We cap how much money we we try, another way we spread the money is that we can't spend all of the money on one child. We do all of the necessary things, so it's not like we're doing braces, and some of these children need that. So we do an outreach service where we find if someone needs additional care, something like braces, then we try and find a provider that's willing to negotiate with that family.
How excellent, that's amazing.
Yeah, we have actually a person in-house that specifically does that will find additional care, whether it be if someone needs surgery or if they need imaging or mental health counseling, they will find that provider.
Wow, so you guys will reach out to other people to put you in the place that you really should and need to be. That's fantastic.
Daily.
Excellent. So during the break, we were talking a little bit about Medicaid here in Utah and kind of how that's changed a little bit, and the minor expansion that the government and the legislature has passed to provide health care to a few of Utah's less fortunate. And can we talk a little bit more about that expansion?
Sure. So Medicaid expansion, obviously Utah was a state that did not expand Medicaid. The legislature did come in and did do a very small, very focused expansion to cover individuals who are single with no dependents who make less than $50 a month. So obviously, with that criteria being so low, those are people who it's really targeted for the homeless.
The homeless population.
The homeless population, and that was part of the Rio Grande project, but it affects any homeless person. So in Park City, every year we do a count, and that count is coming up. We usually do it during Sundance. And what we do is find out how many people are living either in their cars or outside, or we can't focus on those that are couch surfing, although we consider those homeless as well.
Yeah, absolutely.
So this legislation actually covers those individuals. So, and those usually are the sickest because they're living outside, they're not getting good, health care or dental care or food, or and so those are our most vulnerable populations. So that was a wonderful thing that they did. Now we're doing, Utah Decides is doing an initiative that we're trying to get on the 2018 ballot in November, and by April we need 115,000 signatures to be able to get it onto the ballot to expand Medicaid in the state of Utah. We believe that the voters should be responsible for making that decision. So I have packets at my office that anyone's welcome to come and pick up if you would like to help in this project. And you take a packet, and it can take up to 200 signatures. So if you're going to have a women's book club, or if you're going to have a Christmas party, come by and get one of these packets and ask all your attendees to do something good during the holiday, and sign on to the Utah Decides project, and let's expand Medicaid.
Expand Medicaid and get health care for not just those who are less fortunate, which absolutely need it, but for everyone in the middle, which we were talking about the gap during the break.
Right.
There's a lot of people in that gap that just don't.
About 100,000 in the state of Utah.
Just in the state of Utah. That number is staggering. So we need those signatures for sure. And so if I were to take a book, I could take it to anywhere as long as they're a Utah citizen?
So they have to be registered voters.
Okay.
And what we're trying to do is each book be a county. So if you were going to take it, I would ask that it's all registered voters in Summit County.
Okay, perfect.
Or if you live in Salt Lake, it would be all registered voters in Salt Lake County, or wherever you live.
Excellent. And where can people go to pick up these books?
I have them at People's Health Clinic. I have probably 200 of these they're booked. They're a little spiral bound, and we've all seen them where we sign on the line, and it will take 200 signatures.
Excellent.
Although if you can only do 20, I would love you to come and...
Even a couple signatures will help drastically.
Absolutely.
So,
or if you just want to come by and sign it, I've got a book going.
That's excellent. And finally, lastly, I guess to wrap things up, your guys' next clinic, which is opening up in Heber in January, do you want to talk a little bit more about that?
We'll be open the first Monday in January at the Heber Clinic, which will be at Heber Hospital in Dr. Cook's office there. And we will be opened from 9 to noon on Mondays, and it'll be our women and children's clinic. So we're going to do OB visits there. And that's how we'll start, and then if we see more of a need, we'll expand time and days there. So we're very excited about that. Thank you for asking.
Of course, yes, it's great to see you guys expanding and providing more healthcare and affordable healthcare to more people across not just this county, but across the valley and back the Wasatch. So thank you so much for that, Beth.
Thank you.
Absolutely, it's been a pleasure. Happy holidays.
Thank you, you too.
Absolutely, be sure and get to People's Health Clinic, and if you can't take a booklet and don't have the time, at least go over there and put your name down on the signature to expand Medicaid. There's a lot of people in Utah that could use the health care and need it desperately for the next coming year. We'll be right back to wrap up the first hour on the Mountain Morning Show right after this.